And welcome back. David in, is it Rifle, Colorado? David?
That's right.
Hey, thanks for watching Free Speech TV. You're on the air with Congressman Pocan.
Good morning, Tom, and good morning, Congressman Pocan.
Good morning, David.
I just wanted to chime in on the Medicare for All issue. On Monday, Tom was out of town and had Alex Lawson of Social Security Works sitting in for him. And he made the statement that now is the time to fight uncompromisingly for Medicare for All. You know, we can talk about the ways of implementing it, but we need to stand firm on that one simple issue. And I just wanted to add my 2 cents that that's what I'd like to see happen.
David, I agree. I mean, I think what you're going to see, not just this week, because this is a couple committees doing a markup, and we just finally saw the language this week of what their alleged proposal to be an alternative is, but the fact that this is going to go for, I would argue, weeks and months, because this is not going to be easy, and there are going to be phases, and they're going to realize things don't work out. And when we get that CBO score next week, you're going to see exactly who the losers are, and there's going to be a lot of losers under their plan. So I would argue just what you're saying is let's make sure that not only do we constantly talk about this through this debate, but I think we can make this an issue in the 2018 and 2020 election cycles. Even though the Republicans are in charge of Congress and there's zero chance that it'll pass during this session, we can start to make the argument and the case for why this is the proper way and actually hold candidates accountable that this is the best alternative that could be out there for us.
There you go. Michael in Winter Haven, Florida. You are watching Free Speech on DirecTV. You're on the air with Congressman Pocan. We just have 90 seconds to the break. Michael, real quick question, please.
Yes. In 72, Thomas Eagleton had to step down as George McGovern's running mate because of psychological problems he had in the past. If a candidate for vice president has to do that, can Congress require the president to at least get some to review his psychological state?
Michael, so first of all, I think many of us would argue now, with much more information, I think, than they had in 72, that, hopefully Eagleton never should have had to step down for what they were attempting to say about him. But I do think that in this particular situation right now where we're at, more and more people, and it's not just partisans who are saying this, are concerned about the mental health of the president. And I know that Ted Lieu, one of my colleagues from L.A., has actually introduced a bill to say, let's at least have someone who can provide mental health services at the White House level and have some capacity to be exploring the problems we're having. And then just this weekend, I've seen people who have not gone down this path before starting to really seriously question his stability. When you accuse the former president of wiretapping you based on, from what we can best understand, either a Breitbart article or the fact that maybe there is some kind of actual intelligence, although we can't find it yet, a review because he may be in violation of a law from what he was doing during the campaign. Either way, he hasn't put anything forward, yet he wants us to investigate it. We're starting to see an instability there that I think is of great concern.
Gary in Washington, D.C., listening on Sirius XM. You're on the air with Congressman Pocan.
Hello, this is Gary.
Hey, Gary, you're on the air.
Oh, okay. Hey, look, I'm going to give you a quick story. I've been paying into the healthcare system since I was 19 years old. I'm now 70. I started working for the United States Postal Service when I was 19, and I paid in for basically 47 years into healthcare, except for the 4 years I was in the military. It seems to me that a lot of people didn't get in the common sense line. Healthcare was very inexpensive for me. I really didn't need it, but I got it. And I don't understand when you have more people paying into the system, it's going to work out. It's going to be cheaper for everybody. Now that I'm older, I'm going to start, utilizing it more. But I just don't understand why the common sense issue is people miss the common sense issue. More people, cheaper rates.
Gary, you're right. There's no question. That's why I think Medicare works so well for the populations that get Medicare, why the VA hospital works so well for our veterans, and that's what would work best for the healthcare system. The Affordable Care Act made some really important standards, like the fact that about pre-existing conditions and lifetime caps, et cetera, that are important, that now I think are kind of accepted as universals that you have to have. But, the fact that this Republican plan is going to make things more costly, especially for older Americans, provide less coverage, that's not health care. We're going backwards. We're not going forward. And going forward is finding a system that makes sure that everyone has access to health care, and let's make it more affordable by doing it smarter, which is, I think, what you're suggesting, Gary. Thank you. Ken
in Great Falls, Montana. You're on the air with Congressman Pocan.
Yeah, thanks for taking my call. As the single payer system is the holy grail for us progressives, also the carbon tax would be far better than the clean power plan. And there's a bunch of Republicans pushing a carbon tax. And I'm wondering if the progressive caucus is looking at this and is going to get behind a carbon tax again. That we really need to go that route.
Yeah, Ken, thanks for your question. So there are a couple carbon tax proposals out there, and there are some deficiencies in the Republican one that don't go as far as I think the one that I've seen put forward by some Democrats. However, I do think just to the issue in general, there are some conservative think tanks that are in support of carbon tax for I think the same reasons that you are, which is that let's make sure that if people are putting carbon out, they're the ones paying for it, and that might help encourage them to have different behaviors, to invest in other ways to have less pollution and still produce the energy they need to. So a carbon tax in and of itself, I am a strong proponent. I think there are some deficiencies in the Republican bill that don't go in the correct direction. However, this is something because there is some potential for left and right support because it's someone who's generating the carbon should pay for it, not all of us, that I think has some promise, and we definitely need to keep it on the table.
Okay. Anna in Elk River, Minnesota, listening on AM 950. You're on the air with Congressman Pocan.
Hi there. I have just a quick anecdote about national health care and then a question for the congressman. I talked to a guy in his 70s from Norway. He's lived here for quite a few years. He describes himself as an independent. He doesn't think either side should be having ultimate power, but he said he wishes he could go back to Norway because their healthcare system is wonderful. You go to the doctor, period. It's all paid for. His two points on that were that their taxes, he estimated, were income taxes were between 40 and 50%. It's horrifying to us, but his other point was that they wouldn't work for the wages, and they don't work for the wages that we as Americans work for. A $40,000 a year, for example, driving job is unheard of over there. So my two-part question is, why aren't you Democrats talking about a national health care, not Medicare for all, because that still involves the insurance companies? Why aren't you talking about national health care, giving us information and facts about why you don't think that will work? I mean, why can't we take the health insurance burden away from employers, raise wages? I know that sounds simplistic, but why not? Why aren't you talking about that? Why are you constantly compromising away what really should be when it works around the globe? Why won't it work here?
Let's let the congressman answer.
Sure. Well, I think some of us are. I mean, I think that's the point. I think a lot of us in the Progressive Caucus are saying single payer is the system that we have wanted all along. The problem is within the broader picture when they passed the Affordable Care Act, there weren't enough votes for it. We actually had a public option, and it fell away in the Senate, unfortunately, when that passed. So I think there are a number of us who are advocating for it, but I think I'll refer to what I said earlier. The problem is if the press doesn't pick it up, it doesn't necessarily get the attention. And even though there's bills introduced in Congress to do this, and we're working towards it, and I think what I'm saying today is exactly in alignment with what you're saying on it, it's been more difficult to get it to the forefront. I think, though, this debate right now is going to bring this to the forefront. This is exactly what we needed, is to realize that this isn't easy, as the president said last week, and there's a reason why, because it is so convoluted with the current system we have with all the insurance companies and other middle companies in between taking little bits and pieces. So we have, in our Progressive Caucus budget, once again, we will put that part about single payer as one of the major provisions in the caucus budget. And last time we put it, that we got a vote, we got a majority of Democrats in the House to vote for it. So it's certainly out there. It's just sometimes it's harder to get through the clutter of the mass media.
Ramona in Gainesville, Florida. Ramona, we have only 2 minutes till the end of this hour. So a quick question for Congressman Pocan.
Yes, sir. I've never heard this brought up before, but wouldn't it save small businesses and big businesses a lot of money to have universal health care, because we would no longer need Workman's Compensation insurance?
Yeah, I'll tell you, there's so many things. If you think about how our current system works, Ramona, and I've been a small business owner of a small union printing firm since I was 23 years old, so 29 years now. When you look at what we have to, that could otherwise go to salary, that it goes to benefits, it's been an increasing portion of costs. Before the Affordable Care Act, we, on a regular basis, had 20% increases in those health care costs that we have, and then we saw the part where now people pay bigger and bigger chunks every month, co-pays, into that monthly premium, and you're also seeing people's deductibles go up. So at some point, you've got to figure out how to address it the best, and this is an expense for big and small business. So when Thom and I, refer to the auto industry and the fact that it's $2,400 a car is just their share of healthcare costs, which makes us less competitive, I would also argue as a small business owner, that's a big chunk that goes out in health insurance that otherwise could be other compensation for employees. And, quite honestly, we already pay into a lot of things for our taxes. We could do this much more efficiently if we had that single-payer system rather than the current system we have, because a lot of that money I'm paying out for health insurance isn't going to health care, and it could be far more effectively used.
But the insurance companies are fighting it, and as she pointed out, the Workman's Comp insurance companies are going to fight it too.
Absolutely, and there's all sorts of things. If we actually did the math, and I'm sure it's out there, our organization has done this, that is a really strong argument. I would agree from a small business perspective of why this makes sense.
Yeah, I agree. This radio show is a small business, and we provide all of our full-time employees with really good health insurance, and we still have to pay into Workman's Comp and everything else. And well, you know this, Congressman.
Yeah.
You run a print shop there in Wisconsin. Congressman Mark Pocan, thanks so much for being with us today.
Of course, Thom. Thank you.
It is always a pleasure talking with you. You can find Congressman Pocan's website at pocan.house.gov. You can tweet him at @RepMarkPocan.